Assalamu alaikum. Hello and welcome to webinar number 9 of the MS Patient series. My name is Gerard Moore and I am the support manager here for Focus Gulf Conferences. The date is the 26th of September and it's 3 p.m. here in the UAE. We'd like to welcome you all from wherever you are joining from us. Today's lecture is always supported by SSMC and SAHA, and thank you to the supporting company of Roche. If you have any technical issues, you can message me on the admin only button on the chat bar, or you can press the red reconnect button at the top of your screen. The webinar will last for 1 hour and it will be recorded and you will have access to it for the next 4 days. I would now like to hand you over to Dr. Ahmed Shatila, the moderator and chair, as always, to do the official opening. Dr. Ahmed, please.
Thank you, Gerard. First of all, welcome to our MS webinar that is hosted by SSMC, sponsored by Roche, and organized by Focus Gulf. Today we have Dr. Yasmine Kamal from Rashid Hospital. She is a senior neurology specialist over there, and she cares for a significant amount of MS patients. And today she's going to talk to us about the future of MS. So without further ado, I would like to leave the floor to you. Thank you, Dr. Yasmine.
Thank you, Dr. Shatila. It's my pleasure to be here today. My talk to you all today is basically focused on the future of MS, the landscape of MS. And I wonder if you as patients, when you go to visit your physicians, you definitely have a lot to say, and definitely 40-minute or 45 visit minute at any physician is not enough to explain what happens in your day-to-day and your daily symptoms. So the future of MS and the landscape, I think, is going to change very much in the coming few years, and that's why I picked today's topic to talk to you. Let me share a few slides that I have. So, as you see, in the middle of a desert, a beautiful oasis is there, and it gives us all hope that no matter how difficult things are, it's always there's always hope. So I will start by this letter written in 1827 by a patient, and it reads that my strength of legs had quite left me, and twice in one day I fell down upon the floor in attempting to go to the closed stool without assistance. I find that where I too attempt to travel far of a day, I should be rendered incapable of proceeding. I am able to ride for 3 hours at a time with pleasure, or to walk for 2 hours without being over fatigued, but I cannot run or dance, and even going downstairs was unpleasant to me. This is 1827. Now moving to 2016, still symptoms are there, and we haven't, as physicians, figured out a lot. Still, there's a lot of advancement that happened, obviously, but still, we are not there at a cure. So in 2016, a letter is written by a patient, and it reads, I'm referring to that period of time after I've tried to act normal, when I've went out and actually did some sort of activity like most people do. For me, the day after an activity is typically filled with fatigue, pain, and even confusion that necessitates me doing next to nothing. It's primarily that because my legs will be weak, any attempt at standing and walking is tough. Just making it to the bathroom becomes an adventure. And the letter goes on. So still in 2016, and I believe still until 2020, we haven't reached a cure. And we find it difficult from a patient point of view to sit down and to explain each and every symptom that you go through every day. So I will go very briefly on what actually happened. What's the mechanism that happens in MS? The main thing that happened is demyelination. And The brain cells, the brain and spinal cord, actually are formed of nervous cells. These nerve cells send impulses to give orders to eventually make our muscles walk and make our ideas and speech start functioning. So the nerve cell sends these impulses along an axon, and this axon is covered by what we call myelin. The myelin is made up of fat layer, like a Swiss roll. If you know the dessert, the Swiss roll, this is how it is covered. This myelin is there to cover this part of the axon that relays electric impulses. So normally the electric impulse flows in the axon. The myelin is there to protect it and to make it speedier for this electric conductivity. There are spaces in between the myelin sheath, and we call it the nova inviera, where the impulses jump. This is a normal. Now, if there is a disease in the myelin sheath, there is damage to the myelin sheath, and therefore the electric conductivity is no longer as fast as it should be. In MS patient, this is basically what happened. The myelin sheath is damaged, and this is why we call it demyelination. And if this continues, demyelination continues to happen, the axon is no longer protected, and then we start seeing that the axon later on can be damaged. Now, fortunately, some of the nervous cells are there to start producing new myelin. Okay, maybe it will not be perfect, but that's a normal phenomena that may happen, that a new myelin could start being produced, and these cells are called oligodendrocytes. Now, in MS patients, these cells actually could or may not be functioning as well. So when this demyelination happens, they do not have the functioning cells that will start to cover the myelin again, and so the remyelination process may also be affected. So I chose also another slide. I'm not going to go into details. I don't want to complicate things, but I just want you to understand, why does the demyelination happen? It is an autoimmune process. What is an autoimmune process? It's basically that the immune system in the body goes wrong. Something goes wrong with it. What happens actually? In our blood, there are multiple immune cells are there to attack any virus or bacteria that comes to our blood. That is a normal phenomena in the blood, in the serum. Now, what happens in MS, we don't know what exactly makes the immune system go wrong, but there are some theories that certain viruses or certain things in the environment might cause the trigger to the immune system, such as a virus called Epstein-Barr virus. It's a possibility. It's causing this whole initial cascade, or another virus, herpes simplex. They may have triggered this wrongdoing of the immune system. They enter the blood, and once the immune system starts seeing them, an antigen presenting cell says, hello, I found something. I found an abnormal virus here. And once it sees it, all the immune system want to come and want to attack this virus to protect the body and the blood, basically, from having an abnormal virus in it, or an abnormal antigen, we call it. So more immune cells come, the T cells start to increase, giving CD4, CD8, and these CD4, CD8 invite even more immune cells, such as what we call the B cells, the macrophages or monocytes, and these start to produce different molecules that start to stick and adhere to the blood vessels and start to find their way into the central nervous system of the brain and the spinal cord, where typically they should not be there. So this is what goes wrong, that a lot of immune cells have attacked the virus too much and are continuing to produce these immune reactions. They start passing into the blood-brain barrier, we call it, and they reach the brain and the spinal cord. Once they reach the brain and the spinal cord, what happens is that they start producing odd antigens, the myelin antigen, myelin basic protein, and MOG, and these start to remove the myelin sheaths from our axons, and they cause demyelination. So typically our body has inflammation, the autoimmune process, and we have anti-inflammation. The anti-inflammation should stop this process at one point, but it doesn't happen in MS patients. The inflammation is too much, and therefore the whole cascade starts ending up into what we call the demyelination, as you see here. There are another good cells that we call the oligodendrocytes. These are close to our nervous cell, and they want to start to repair the damaged myelin. But in MS, these oligodendrocytes, unfortunately, are not produced and are lost. So therefore, it is not there to start producing the and remyelinate again the damaged myelin. So that's the other thing that happens. So since 1995, disease-modifying therapy came, and I'm sure you're all very familiar with it. So since 1995, we had the injectables, interferons, and they are there only to modify the disease, to try to slow it down, okay? And then in 2000, the Copaxone or glatiramar acetate came. In 2005, a more efficacious or more efficient drug came called natalizumab that came in 2005. It was an infusion, so it was good news. Again, in 2010, even better news, oral tablets came for MS, and this was really a breakthrough in MS. And then another drug came, teriflunomide, and then another very highly effective drug called alemtuzumab came in 2013. Then again, another tablet, dimethyl fumarate, which is Tecfidera, came, and the pegylated interferon came in 2015. Another drug, daclizumab, came in 2015, but in 2016 was removed. Cladribine came in 2017. Then ocrelizumab, the Ocrevus, was approved in 2017. It's an infusion 2 times a year. And again, Gilenya was approved for children in 2018. The most recent news was in 2020, supinamide, a new drug. It's not here. It was approved in March 2020, and it is for the secondary progressive relapsing MS. So all along the years, we have been seeing probably all those DMDs, we call them disease modifying, because they try to slow down this demyelination, they try to stop this demyelination, but no treatment has been so far approved for the repair. What about the repair of the myelin sheath? None of these drugs can actually treat the damage that happened. We can only slow it down at the level of the cascade that I showed. If one of these drugs work on one of the cells that I mentioned a while ago, then that is how it modifies the disease. But none of them works at the level of bringing back the myelin sheath to the damaged areas. So there's a lot of research now to understand how does remyelination normally happen in the body. We don't know really how these oligodendrocytes, the details of it. So a lot of research is looking into how do these cells remyelinate and start putting back the myelin sheath where it should be. A lot of research also is there on how to reverse what happened, the damage that happened. So some of these drugs that are still in research, they are not approved, they are still in clinical trials, is a drug called clemastine. This is an old anti-allergic drug, with a combination of medicine for diabetes. They're still looking, we're supposedly looking in it. This trial is stopped now because of the coronavirus. Another drug that is hopefully a promising drug, opsinumab, It is also for remyelination. So it's still under research to see if it will prove to be effective in remyelinating those damaged, demyelinated area. Another drug that is also under trial is the bexarotene, which is also for remyelination, and still there is a lot of drugs that are looked into to try to deal with the repair and not only to slow down the disease. So these are all that I'm presenting now is related to the repair. So this is the good news, that we have a lot of clinical trials. None of them are yet approved, but they are still ongoing. The challenge in these trials, I think, is mainly how to prove that these drugs are actually working. And by working, I mean they need to test them. How to measure the remyelination? Okay, these are very technical things, and to measure it, it's very difficult. So new MRI techniques are being developed to try to measure exactly in the brain and the spinal cord, do they see that these areas of demyelination have been repaired or not. Another method is evoked potential, to see the messages that is coming from the sensations of the body to the brain. Has it improved or not? And another measure is also to measure the retina of the eye and the optic nerve to see how much repair can happen at that level. So what's on the horizon for the MS? I believe remyelination is hopefully a hope for all MS people, that once we have a reliable drug that hopefully will be helping in remyelination, it will be a good start in this revolution of remyelination. And the other thing on the horizon that is not really directly into treatment is the trends in technology. This is very important. I think that technology now has affected our life in everything, not only when it comes to health, but in everything. I mean, now you can do your shopping online from A to Z online, and you don't need to go to the stores like before. So I think as much as this has affected our life in shopping, in studying, in transport, everything is now has become digitalized. I think medicine and healthcare is not really an exception. It will take its time, but it's coming. So I think technology is going to be very helpful in the field of healthcare as well. So this is what's on the horizon, I guess, is that to empower and to self-manage for all people with MS to be empowered and self-managed. You don't need now to go and sit for 2 hours to describe your symptoms to your physician. Because no matter how detailed you describe, there are things you will miss, and there will be limitation in the time of your visit as well. So this is what is coming. The new trend is that for the patient to be empowered and to self-manage to a certain extent, obviously, not to fully, but to a certain extent. So how to empower and self-manage? When you're facing a lot of symptoms, and symptoms starts from fatigue to numbness to electric sensation to weakness, and it goes on. How can you be empowered if there are very unpredictable symptoms? You don't know when they will come and when they will disappear. And it's the complexity, it's the difficulty of when do you know that you're well and when you don't know. So I think these are skills that people with MS and their physicians should start to learn. There are new skills that are there, and there are growing trends and new apps that are being developed and already are there that eventually will be of great help. So rather than not being sure of how to tell your physician, because you see them every 3 or 6 months, you won't be able to talk in details of what happened on daily basis. But these apps will help you and will help your physician to be able to reach a better outcome. So the mobile applications, there are plenty that are available. I will go through them in a bit, but their main goal is that to teach patients about MS in general. Some patients are newly diagnosed, they're not sure of so many things, so some of these apps will be helping in education. Some of these apps also will mainly be targeted towards your daily symptoms. You will be able to express your daily symptoms on these apps. And some of these apps also will help you with the treatment. It will be reminding you when you're supposed to take your treatment. It will also be reminding you if there is injection sites that you've taken it in that site, you need to change it to that site. So a lot of it will be helpful when it comes to treatments. In general, these apps will be helping in the health status. It will help you in your own lifestyle. If you need to exercise for a certain amount of time, it will remind you it's now due, you should exercise, and it will be also be able to track how much exercise have you done. It will also be able to assess in the psychological status. So a lot of the time there are simple questionnaires to be answered related to the mood, how you feel, and so forth. When it comes to the fatigue also, these apps will be able to detect the days that you were unable to move a lot because you're fatigued. And rather than it being a subjective symptom that we cannot tangibly, we cannot يعني I'll mention it in Arabic. الإرهاق في أحيانا صعوبة إن إحنا نعرف كأطباء في فتيج ولا لا، ودي حاجة مهمة، لأنه أغلب المرضى ممكن يقول أنا ببقى تعبان ساعات لا، لكن في apps معينة some of these apps هتقدر تقول في إحدى بعض الأيام الحركة كانت قليلة، ده معناها إنه كان في إرهاق. So these apps will be able to capture if you are fatigued, you are not able to move a lot, and then we can find out the analysis of this data to tell us that yes, the patient has been fatigued for so many days a month, and so forth. So these online application, it is a tool for MS people to be able to self-manage, and you'll be able to collect your own personal data and to be able to understand more your symptoms. It will be personalized. There's a lot of apps there, so there's a lot that has to do with what you prefer to use and what you prefer to pick in this particular apps. And it will also be very helpful to your physicians so that instead of sitting with them for as long as 1.5 hours and not able to really express those subjective symptoms, it will be a very good analysis for them to understand what really goes on in the last 6 months when you haven't seen your physician. So this is just a simple cartoon to show you that these self-managing tools, you will be able to report your symptoms on these apps. At the same time, these apps are educational. When you are able to report your symptoms on these apps, you yourself, or if a caregiver is needed in this case, will be able to get a good idea of this data as well as your healthcare profession. And putting the data and analyzing it, these apps are there to analyze your symptoms. The outcome will, I think, depend. If they are helpful apps, you will continue to use it. The frequency of use will increase. More subscribers will be there on these apps. And eventually, the quality of life will really improve if they prove to be helpful apps. So I'm just listing here some of the available apps that if you're interested in, you may have a look at them. Now, some of them are general apps, not necessarily for MS, but for general, anyone who has high blood pressure or diabetes or so forth. There's a lot of apps that are there online for these general health conditions. So there are general assessment apps. There's medication for any health issues. And there are certain apps specific for MS. My Multiple Sclerosis Diary app. This is an app that helps in the management as well as in the symptoms control. MS Explorer app, Life and MS. MS Self app, I Walk. So I Walk, basically, if you can see, I just had a small picture of how to log in into it. It just tracks you and decides how much you walked, how much it was your gait, and the steps, how careful they were, and it analyzes it at the end. MS Mate, there's MS Buddy, Elevate, Radar CNS, and Floodlight. I am actually familiar with the Floodlight, and I'll go through it. That's another. My MS Diary is one app that shows you, if you're taking the injectable interference, the sites of injection and when you should shift. That's one app. I'm familiar with the Floodlight because I've actually used it with a few of our patients in one study. So I will go through it just to give you an example of what the technology and these application promise in the future. So Floodlight, it actually can measure the active and passive abilities of patients. So it does both. By active, I mean you log in as you log in into this app. It asks you questions. It requires some effort from you to answer and to do some activity on the phone that I will go through, to walk with it, and it does a daily measurement for the patients. The passive is basically, it measures the amount, how many steps you walked. It analyzes the steps as well as the stability. So the Floodlight basically checks the brain, the hand, and the body function, and it's a daily monitoring to see your daily symptoms. For example, one of the things is to draw a shape. This is one of the questions it will ask you. It will give you a shape. It will ask you to draw it by moving your hand on the screen of your mobile. And it analyzes how accurate your drawing was and compare it to your future drawings. So this is one example. As you see, you hold the phone in one hand and you start drawing. So and this is one activity that you will do. I think in total, the Floodlight in particular takes about maybe maximum 5 minutes every day of total assessment. But these 5 minutes are crucial every day because it compares your data every day. So this is to draw a shape, simply to ask to draw an 8 or a ribbon. And again, the Floodlight, this is the app that I am giving an example of today. It measures brain activity, so it asks you about your mood, simple questions, and it asks you to match symbols and digits. Then when it comes to the hand functions, it asks you to draw a shape. It asks you to squeeze a tomato, which is a nice, it's like a game, you know, it puts tomato, you squeeze it, and how accurate you do it is also part of the checking the abilities of you every day. The other part is the mobility. It's checking the mobility. So it gives you a 2-minute walk. It asks you, please walk now. It talks to you. These apps could be vocal as well. And once you start to walk after it gives a whistle or something, then it asks you to stand on one leg, take a U-turn, and these are all things that are measured. There is the passive monitoring, which is, again, the app is measuring you every day, how many steps you're walking, how much you walked, and how stable you were, and so forth. This data is analyzed for you to be able to tell, are you doing fine? Are you drifting from what you expect? Are you actually improving? So these apps are very important for you to understand how you're doing. And obviously for your physician to look into if everything is going in the right direction or not. I believe that these apps are still going to be much better developed. So far, there are few that are there. I think they are helpful. I'm encouraging you to actually try them and see if any of them suit you and are actually helpful. This will be for a much better outcome in the future. And I think we should start from now trying these apps and seeing if they are helping you, then you should actually continue using it. And whatever you feel, if they were useless, there are much more other apps available, and you can just start looking into it whenever you can find the time and decide that yes, you want to use one of these apps. By this, I think this was my last slide. I just wanted to bring a beautiful picture in Dubai. This is Miracle Garden, and I've been there so many times, but it's always changing and changing in a more beautiful way. So by this, I'm ending my talk. I wish everyone to stay healthy in these difficult times, and I'm hoping that you would try one of these apps and decide if any of it was helpful. Thank you very much.
Thank you very much, Dr. Yasmine, for the very interesting and informative lecture on online apps in MS and what's to come. I guess I'll ask the first question. A lot of times, you know, when we see people in clinic and we're emphasizing on, you know, treatment, a lot of times they're just focused on what about repair? What about repair? And even though repairing mechanisms or repairing medications are in the future, I emphasize that yes, it's coming. Hopefully we will get it, inshallah. You still need to take medicines to stabilize your disease. And how do you usually approach these patients? How do you usually approach people that are just focused on the repair and they're not focused on stability?
So we have a big number of patients that I see in Rashid Hospital, and to tell you the truth, most of my patients are obviously on disease-modifying therapy, and I think that disease-modifying therapy, whatever is there currently, has been of great help. And I think that until a repair is there, a drug that will repair, which is not currently available, patients have to be on disease-modifying therapy because this is what we have. They work, and the chances that you'd be only waiting for a repair medicine is that until it comes, the damage would be there. So definitely you have to be on medication if your physician have prescribed it to you, and they work. This is that from an experience of seeing so many patients. We have more than 500 patients in Rashid Hospital, and it helps disease-modifying therapy, definitely.
Thank you. And another thing I sometimes notice is even when we give medications for stability, people do improve sometimes once you stabilize the inflammation and the new lesions. There is some level of natural remyelination and natural repair that happens in your brain, correct?
Yes. Obviously, we cannot promise this to patients, but yes, from my experience, we see a lot of patients that once they start their disease-modifying therapy, they actually improve. Whatever was symptoms they were complaining of before, it actually may disappear. So that's one thing that is there. And whether it's because the inflammation has settled, whether because they are doing physiotherapy and rehabilitation, they are all a combination of things. And whether the lifestyle itself, once you get a diagnosis of any disease, be it MS or any other disease, you start changing your lifestyle to a healthier one that probably works as well. So being on disease-modifying therapy, doing your exercise or physiotherapy, and having a healthy lifestyle all work together to improve whatever has happened. Yes.
Thank you. Much appreciated. With that, I will leave now the video or the virtual floor to Gerard.
Hello.
Thank you, Dr. Yasmine. Questions.
Yes, we have lots of questions. Thank you for an excellent presentation. It's sparked a lot of debates a lot of questions on the chat bar. So I will dive right in, and maybe you and Dr. Ahmed can answer them accordingly. One question, the first question, I'll take it in order, was do you foresee a way that I can control my relapse better in the future? Some people are asking about drug treatments. Will they, in the coming future, will they be able to control their relapses better? Is that in the near term or in the long term?
Yes, please, Dr. Yasmine.
Okay, so I think with having the technology now, you can actually understand, are you having a relapse or not? Because sometimes we get confused, and patients themselves may get confused. One day, if you are not feeling well, is this a genuinely a relapse or not? I think using the new technology, the apps in the future will actually be able to help us identify when there is a real relapse that is happening. So this is one tool that in the future will be helping us to understand these relapses, because we know that sometimes you may have symptoms, but they are not a relapse, even if it is alarming. Sometimes these are not genuine relapses, and you end up going to some physicians. If they are not neurologists, they will be giving you steroids and so forth, and then you end up going to your neurologist. They might tell you that wasn't a relapse, you didn't need to take steroids. So as well as shifting your medication, for example, from one drug to the other. Also, using this new technology, I believe that it will make it a better decision for us, because we have something tangible rather than subjective symptoms that may be fatigue and numbness and things that come and go. Having a tool to help us identify, is that a real relapse or not, we will be able to treat better, I believe. So in the future, using these technologies, I believe it will help and guide both the patient and the physician on, yes, this is a true relapse. Yes, you need steroids. We might consider changing your medication. I'm just giving an example. Or no, this is not a relapse. You are doing well. You have symptoms that are resurfacing, because we know in MS, symptoms can resurface. So my answer is, in the future, I think with these sophisticated apps and with it being more upgraded in the future, it will really be helpful in detecting a relapse and acting accordingly.
Thank you.
Thank you. Okay, thank you, Doctor. The next question is, so let us say they released a remyelination medication. Medication. Does that mean we will be normal, or at least MS-free, since we are on DMD?
You know, that's a very good question. You see, it all depends on how much remyelination, and as we know, sometimes there's scar tissue that develops in the brain as a result of the chronic years of demyelination. So no medicine will probably be 100% remyelinative, as you say. But I mean, who knows? We just got to wait and see what medicine comes out. So it's hard to speculate as of now.
Thank you. Next question, quite a broad question, but how to change the view of the community, people that still do not understand MS in the future?
So I think we as humans in general, we all have our challenges in every day. So I believe that humanity in general is moving in the right direction, that we now understand more about each other, and more campaigns of MS that are happening now is making it very more alarming, that yes, as people, we should understand that there are people that are facing daily challenges in MS. That's one disease that, they are walking among us. They are people, and I think awareness, whether on the medias, on television, I think now the YouTubes and all those are much more appealing for everyone. All the direction on the MS days and the activities that MS patients and their supporters should be doing will actually eventually reach a point where we all think of people with MS. They are people. Just like everyone else, we are all trying to help each other, but we need to make the message through all the medias more available. I don't know if this answers the questions or not, the question or not.
Oh, and Dr. Ahmed, I'm sure you have some things.
Yeah, I would say education, education, education. As Dr. Yasmine had mentioned, we are, as a humanity, we are a lot more educated now than we were 30 years ago. And even among our society here in the UAE, if you look at even among the government, just last year, the year before, there was a campaign by the government to change all the handicap stickers. Instead of being called Ma'aq, or which translates to, uh, what, retarded in English? Now it's Ashab al-Himam, people of determination. So there is a campaign just among people as a whole to be further enlightened, further educated, that having a disability is not a retardedness, if you may say, and it's amongst yourself. These are determined people. They live amongst us. They have problems. They are all trying, I think, what anyone else is trying, to try to better themselves, better their families, better their lives. And I think education is the key point in this. And second, I would say watch these videos. It helps. But education is the most important thing.
Thank you. Of course, we have a library on YouTube that we'll be releasing shortly of all of these videos for patients all over the world to get more information from on that. More information coming soon on that. Back to the questions. This person has asked maybe two. I'll combine them into one question. They're asking, what about MSC therapy, stem cells, and artificial intelligence? Have you heard any information about how those things can help with MS in the future?
So yeah, MS stem cells are there in certain conditions, in certain centers. I would want to make sure that if you have a neurologist you're following up, not and it's not for everyone stem cells. It's for very particular cases, and not in any centers, because there are left, right, and middle centers in different countries. But it has to be an approved center, obviously. So I do not recommend that we jump into talking about the stem cells here on a public webinar. It has to be discussed with your physician according to your condition. This is for the stem cells. And the other question was?
It was about artificial intelligence, AI.
Yeah. So all the artificial intelligence are obviously making a big lap, let's say, it's as well as the technology. So these are things that are coming up to help, a tool for patients to help them as well as physicians. So far, we are seeing things probably for the rehabilitation areas that are there, but we are still, waiting for more positive things to come when it comes to the artificial intelligence. I don't know what Dr. Shatila thinks in this particular point.
I think just the first part, like you said, stem cells is not for everybody. It does carry a high risk. It is not standardized. Not all centers across the world offer the stem cells and even the same type of stem cells. So we have approved medications for MS. And stem cells is not an approved therapy for people with MS. And given the risk versus benefit, we have a lot safer medications available than stem cells as of the moment. Artificial intelligence, we hear a lot about it. It's in the news every day. There is definitely going to be a lot of news in the future about AI. Whether it helps patients or even helps physicians in the way of how we can diagnose MS earlier, or how we can track prognosis or worsening, or even pick up subtle symptoms. So I think AI is an evolving platform, and we'll see more of it in the future. And where exactly will it be? We're still watching.
Thank you very much for those answers. Next question, I believe, is from a healthcare professional. For many patients, there are also a cognitive impact. And can you recommend anywhere they can turn to help them manage their schedules, the aids for any support of how they manage their day, their time, their schedules in that way? So anything that they can do, they can point to for their patients to help them in that regard?
Yeah, so as I mentioned, there are different apps. If a patient in particular needs something as a reminder, many of the apps that I mentioned, and it's easy to Google them, are there to work in both directions, in your lifestyle, for the lifestyle, and for the treatment. So those who have symptoms of forgetfulness, for example, they can't focus much and they need something to alarm them regarding their day-to-day activity, these apps that are particularly designed for MS will be very helpful. It will be not only reminding them of their medication and medication sites, but some of the things that they need to be reminded of in their daily schedule. And eventually this will obviously improve the quality of life. So yes, there are apps. I'm not going to recommend a certain one because there are plenty. I recommend that if there is someone that will need it, they should just Google, and one of these apps that I mentioned could be of great help when it comes to the memory functions and the attention and all the cognition as well.
Thank you. I think what we will do is we will get the list of apps from you and we will send that to this entire database of people so that they can check for themselves. So please look out. We will email you in due course the list of apps that Dr. Yasmine recommended. Because the next question was, which app do you recommend? But we will go past that now. And on the app question, are there any apps which are in Arabic? Do you know?
Most of what I know are so far in English. I'm not sure if they are translated into Arabic or not, but I'll have to check for that.
Okay.
Yes.
No problem. Again, we will update you in due course upon that information. Again, following on with the online field of questions, this person asking about the need for better community online supports, and are there any online groups, social media wise, in the region that you recommend people to join?
I think as of now there are a couple online platforms, either via Facebook or WhatsApp, but these are not supported by any single body, either governmental or by a society, like, and I mean society as VUAEMS society. I think as we go forward and people start raising their concerns and their voices, such a thing needs to be done. But as of now, I don't know of any government or societal sponsored body of where patients can get together. Dr. Yasmine?
Yeah, I believe that in the UAE there are few patients that are having their own groups.
Yeah.
So, and I know that some of our patients in my hospital have taken the initiative. So I cannot obviously announce it here on the webinar, but I know that there are few personal activities that they are doing on their own. So again, it's not based on a government or an official society, exactly.
Okay, thank you very much. Next question that's come in, again, talking about a common theme about COVID-19 and MS. How long will this last? It's affecting my MS. What can we do for the future? I know this is a very difficult question, but again, some people are asking about COVID-19 and the future that this holds.
Yeah, so how long it will last, I don't know. I want an answer.
I don't know either.
Okay. I don't have an answer for that. Obviously, the vaccines, they're working on it, and let's see how this will go. It's affecting the MS. So yeah, I'll just have a brief, because I know you had a webinar about COVID and MS, so I'm just going to hit on
Yeah.
very few
It
points.
was a long time ago, though. It was at the start of the
Yeah.
series, so maybe a refresher might be useful for some
So
newcomers.
regarding the MS, number one, we all need to be, whether you have MS or you don't have MS, you need to do the social distancing, and distancing means to try to not to be close to a person about 1.5 or 2 meters. The time that you spend with these people, the duration, the less
Yeah.
the better. You're wearing a mask, you're washing your hand. We all know these are very important, obviously, precautions to be taken. My second thing is regarding treatments. Patients on treatment, they should follow up with their neurologist very closely, because a lot of the treatment we are still continuing, but it depends on what it is exactly. I will not go into details, but yes, treatment should be continued according to your neurologist recommendation. So please be in contact with your physicians. We have changed our practice as physicians, so I might not need to see all my patients physically. A lot of them, I can see them virtually, or they can speak with me over the phone, because I don't want them to come and get infected from the hospital or from me. So whoever needs to come to the hospital is coming because they need to take their medication in the hospital, or they need to really do their investigation because of an alarming symptom, for example. So when it comes to MS and COVID, I believe you should do the social distancing that everyone is doing. I believe you should be in touch with your neurologist, whether virtually or on the phone, or if really needed, then you need to go and do the visits in the hospital according to your physician's recommendation. Um, I would advise you to limit your social activities as much as you can, because this is the recommendation for everyone. Um, so far, the data that is pooled regarding patients who got MS, have MS and got COVID, has not really shown that there is a slightly increase in any issues with MS patients in particular. So let's hope that if unfortunately anyone gets COVID, that it will be going hopefully as safe as everyone else in the population. So my advice is to take your good precautions and to be in contact with your neurologist regularly. It doesn't have to be physical, but it can be virtually or over the phone if you can reach your physician in this manner.
Thank you very much. Very excellent question. Answer to a tricky question. We only have two more questions left. There was one private and the last public one. The only private question today is you touched upon future treatments. I know it'd be hard for you to say, but what is the one that you think is showing the most promise to give us MS sufferers the best chance, the most hope?
So there are a few trials that are still going on. I still cannot say anything because they are still in the very early phases of the clinical trials. So I will not make any comments on that. They are not there in phase 3. So I will not be able to make a comment on something like this. But some of these trials are unfortunately have been stopped because of the COVID. So I don't know if the results of these trials will be a bit delayed because of the COVID. I cannot tell you in particularly which one I am betting on. It's very early. I don't know, Dr. Shatila, if you have a different view on that.
I would say, yeah, I agree with you. It's hard to predict which medication is going to be the best one, because as we know, sometimes certain medications look good in trials, but when it goes to real life, it doesn't pan out. It's not as effective or even as good as what it appears to be promised. But what I would say is that we have currently at our hands some highly effective medications that have been shown to significantly slow down the disease. And these are available amongst our armamentarium right now. So, I mean, what's coming that's good to know, but we do have medications that are available now that can help. And I think let's focus on the now, and the future the future is always nice, but let's focus on what's available right now, is what I would tell someone with MS.
Thank you. Thank you. And final question, Dr. Yasmine. One person was asking, how can they make an appointment with you? Where are you in the world? How can they come and see you?
Okay, I'm in Rashid Hospital. We have an outpatient clinic. We receive our patients there. So anyone who wants to come to our facility in Rashid Hospital, you can call our DHA number, and just simply by taking an appointment through the operator of our DHA number or through our primary health care facility. We have PHC clinics everywhere in Dubai, so it's in Barsha, it's in Nad Al Hamar, it's everywhere. Whoever wants to take an appointment, if they cannot do it over the phone, they can go to our PHC DHA facilities, and they will then be able to refer them to our clinic.
Thank you. I suppose in the interest of fairness, Dr. Ahmed, how can people in the Emirates of Abu Dhabi contact you?
Thank you, Jared. I currently work at Sheikh Shakhbout Medical City in Abu Dhabi. If someone is interested in making an appointment, they can dial 800-50 and they would call, schedule an appointment, and tell them you'd like to meet with me, Dr. Ahmed Shatila.
Thank you very much. Okay, that brings to a close the questions and answers session. Before I hand back to both Dr. Yasmine and Dr. Ahmed for the final closing comments, I would just like to mention that tomorrow we have a pain medication webinar. It's about proper use versus misuse. So if you have any of these symptoms, you can sign up in the email that we will send to you just after this lecture. And then on the Monday, if you suffer from headaches, we have on Monday the 28th, we have a headache symposium with Dr. Mustafa Shara as well. Both will be in the link in the email afterwards. Thank you all. From myself, I would like to hand back to the closing comments from Dr. Yasmine and Dr. Ahmed for today's webinar.
Dr. Yasmine?
So my message today for everyone is that try the apps, have a look at the new technology, see if it's helpful for you. I'm hoping that it will be helpful. If you don't find any suitable app in the future, I'm sure they will develop it much better. So keep an eye on that. It's a very good option for you and for your physician to keep a good follow-up on your case. And I wish you all to have a safe times in this difficult time of COVID. Thank you.
Thank you. I would like to say that MS has been a rapidly evolving field. I mean, as Dr. Yasmine had mentioned, in 2005, we only had 3 injectables and Tysabri. And now we have more than 13, 14 medications that are available, and more are always on the horizon. So no one knows what the future may hold. So I always say be optimistic, be hopeful. In the meantime, there are multiple new ways and new things that we can do as patients who suffer from MS to try to better our lifestyles. And at the same time, I would like to thank Dr. Yasmine today from Rashid Hospital for giving us this enlightening lecture on what the future of MS holds. Once again, I would like to thank our sponsors, Roche, SSMC, and finally Focus Golf. So without that, thank you very much, and I will see you guys next time.
Yes.
Bye.
Thank you. Thank you all.
Bye-bye. مع السلامة.